In today's video, we will help you choose between a Medicare Supplement plan
or Medicare Advantage plan
by showing you a battle between our two moms. Yes, this is a new update to our other video for this coming year where we will discuss my 80-year-old mom who bought a Medicare Supplement Medigap plan and will still keep it for the next year.
or my mom that chose a Medicare Advantage plan and she's 82 years old and would never buy a Medicare Supplement plan like your mom. What? Hi, I'm Kai.
And I'm Ann.
Now, to better understand who made the best choice, we're going to draw a line down the middle and write the word Medicare on top. Now, on the left side of the page, you'll notice the words Medigap or Supplement. Medigap is the official terminology from Medicare to describe Medicare Supplement plans.
The reason we don't like to use the words Medicare Supplement as much is because many people tend to call their Kaiser or their HMOs or PPOs a supplement to Medicare.
That's right. Those plans are called Medicare Advantage plans.
Well, let's discuss the number one reason my mom and our other clients choose a Medigap supplement plan is to keep Medicare as their primary. Medicare gives you the freedom to choose any doctor or hospital in the U.S. Yes, all 50 states.
Any doctor that accepts Medicare, you mean?
Yes, that's true. But most doctors do accept Medicare. Some doctors might not be accepting new patients, but most doctors and hospitals accept Medicare. And you will never have a network or list of doctors and hospitals with Medigap supplement plans. And unlike your mom's Advantage plan, which covers her only for urgent or emergency care when she's outside the network, my mom's Medigap covers her for any problems in all 50 states.
Okay.
Again, the reason for all of this freedom is because Medicare is her primary. Another part of the freedom that Medicare gives when choosing a Medigap supplement plan is there are no referrals required to see a specialist.
But there are Medicare Advantage plans called HMO POS and PPO plans that also do not require a specialist, honey.
Okay, you can wait for your turn.
Okay, well, fine, go ahead.
The reason Medigap supplement plans don't require a referral is because Medicare is the primary. Unlike Medicare Advantage plans where you have to make sure it's a POS or PPO plan, all Medigap supplement plans allow you to go to the specialist of your choice without a referral.
Now, just to be clear, Anne's right.
As always.
Yes, honey, as always. Well, mainly at that point. But don't look at me like that. She's right on the fact that the Medigap supplement plans do not require a referral. But there are some specialists where they will require referral. But it's not Medicare or the Medicare Supplement Medigap plan that requires it. Just to be clear on that.
Okay. The second reason my mom chose a Medigap plan is that Medicare tends to deny fewer claims than a Medicare Advantage plan.
Okay, that's true. But a Medigap is so expensive.
Yes, a Medigap is more expensive, but she does not want the insurance company to be in control. And the peace of mind that she'll most likely get the care she needs is important to her.
Okay.
Okay, now the third reason my mom wants a Medigap plan is because she wants 100% coverage for anything Medicare A and B does not cover. So she bought a Plan G.
Well, don't forget to tell the viewers that she still has to pay the Part B deductible.
Okay, yes. Yes, she does. Other than the Part B deductible, which is less than a couple $100s, she pays no copays.
While Medicare Advantage plans typically have no deductible.
You can't wait your turn, can you?
Okay, well, let me just say one more thing. Plus, your mom has to still pay copays for her drugs, and the Part D is not included.
Okay, that's true. But the drug plans are not that expensive, and she doesn't mind the copays.
Okay, you got me.
This brings us to point number 4, where my mom can customize her Part D. She's typically on generics, so her drug plan is usually anywhere from $5 to maybe $20 a month. Most of our customers usually fall around that range. Some might pay upwards of $100 or more, but that's rare.
That's true.
But the idea is she can find the best drug plan to fit her needs, and if she doesn't like it, she can change her plan without changing her entire health plan like your mom's Advantage plan. Your mom has had to find new doctors every time she's changed her Advantage plan.
True.
Okay, so that brings us to the fifth and final reason she chose a Medigap plan is that the monthly cost is the least concern for my mom.
Well, why not tell them that it's usually around $2,000 to $2,400 more per year for a Medigap than a Medicare Advantage plan? Plus, there's also rate increases on Medigap plans every single year.
Okay. Yes, that's true. But she doesn't mind those rate increases. Plus, we look for plans that have the least rate increases each year. If you're leaning towards a Medigap Supplement plan, we will show you a Medigap playlist where we expose how insurance companies raise their rates.
Now, while Anne's mom made the best decision based on those 5 points, here are the 5 key points why my mom chose a Medicare Advantage plan and why these plans might be best for you. Number 1. No premium or low premiums. See, my mom and our clients choose a Medicare Advantage plan because they're concerned about their monthly premiums, monthly costs. It's already hard enough for them to pay the Part B premium, let alone another $120 to $200 a month. Plus, they have to buy a drug plan. So when you add up a Plan G and a drug plan and everything, the total cost is well over $300 a month. Now, if you add up just the supplement and the drug plan premiums and multiply that over 20 years, you're looking at around $24,000 to $40,000.
But if cost is such a concern, then why didn't your mom just buy a less expensive plan like a Plan N or a high deductible Plan G?
True. Well, this brings us to the number 2 reason why my mom chooses a Medicare Advantage plan each year. She doesn't want a deductible. Most Medicare Advantage plans have 0 monthly premium and 0 deductible. A high deductible Plan G has a $2,700 deductible for this year, and it goes up every year. And also, depending on your age, you're still paying a monthly premium of $50 to $100 per month. And if you were to compare that with most Medicare Advantage PPO plans, they typically have 0 deductible to at the most maybe $500, and still with no premium. Now,
what about a Plan N Medigap plan?
That's even worse. Plan N premiums are now averaging around $100 per month in most areas if you're 65 years old, and upwards of $150 depending on age and zip code. Again, the main reason that my mom and our clients buy a Medicare Advantage plan is because they do not want to pay that premium.
But then isn't your mom controlled by a network of doctors and hospitals?
True, but she doesn't mind that. So that brings us to point number 3. The third reason my mom chooses a Medicare Advantage plan each year is because she's used to a network, just like any HMO or PPOs that she's had through work. The freedom to go to any doctor that she wants with Medicare does not outweigh the extra $150 to $200 a month or more that your mom is paying.
Okay, well, how about this one? You hear all the time that people are getting denied left and right on Medicare Advantage plans and how the Mayo Clinic doesn't even accept Medicare Advantage plans. Ultimately, the insurance company is in control and you're not covered by Medicare anymore.
Okay, that last part you said is true. Now let's talk about point number 4. The insurance companies are in control because Medicare is paying the insurance companies around $1,000 a month so that if you get sick, Medicare is no longer responsible to pay your claims. The insurance company is solely responsible. They become your primary and replace your original Medicare plan. Now, when you're under a Medicare Advantage plan, you actually forfeit your original Medicare plan as your primary. Now, those who buy a Medicare Advantage plan, like my mom, don't mind the insurance company being in control. Yes, my mom is no longer covered by Medicare, and yes, the insurance company is in control, but this is no different than her employer's HMO or PPO plan being in control. Now, do Medicare Advantage plans tend to deny more claims than original Medicare? Sure. Do I hear that Medicare Advantage plans are denying people left and right? Yes. Is that true? No. See, people use these articles and stories to scare people from buying a Medicare Advantage plan. However, my mom is living proof that her care and surgeries have been covered even when she fractured her hip a couple years ago. Now, think about this logic. If Medicare Advantage plans were denying people left and right, then your neighbors, your family, your friends would all tell nightmare stories about how they were denied. Yes, Medicare Advantage plans do deny more than Medicare, but the risk is not as high as people make it sound, and ultimately it's a risk that my mom and many of our clients are willing to take as long as we tell them ahead of time.
But why are they willing to take that risk?
Well, that's because my mom wants a 0 premium, 0 deductible, and the extra perks at no cost. So this brings us to the 5th reason why my mom chooses a Medicare Advantage plan each year. Everything is all bundled together. Medicare Advantage plans typically have dental, vision, gym memberships, over-the-counter items like Advil and vitamins, acupuncture, transportation, and so forth. That was long. And the Medicare Part D drug plan is also included as well. Not only is your mom's Medicare Supplement plan around $2,000 to $2,400 or more per year, she has to buy a separate drug plan, a dental plan, a separate vision plan, and your mom doesn't get any of those extra perks.
Okay, I definitely can't beat that. However, having those extra perks all bundled does not outweigh giving up the freedom and control that my mom has. All right, now you've learned the 5 reasons on both sides. Which plan is best for you? Well, in review, buying a Medigap plan gives you more freedom. You can think of this like owning a house. If you own a house, the cost up front is usually more. Nothing's really bundled in. You have to pay for your own repairs, property tax, and so forth. But you have the freedom of ownership.
That's true. And buying a Medicare Advantage plan is like renting an apartment. The monthly cost is usually less expensive, and you might have other perks like utilities, even a free gym membership or a swimming pool, all bundled in. Now, your main concern, though, is the monthly cost and the extra perks included. The idea of ownership and freedom is nice, but the monthly cost is the most important to you.
And lastly, you can ask yourself this final question. Am I a what-if type of person? Now, before we discuss this final point though, if you found value in this video so far, please click the like button below. Also, remember that we represent over 50 plans and can assist in all 50 states. We get paid through the insurance company directly, and so you pay us nothing. Most importantly, we will shop around without bias, and that's why we make videos like these. So, what do I mean? Are you a what-if type of person? You are a what-if type of person if you tend to ask, what if I get sick? What if I want to see any doctor? What if I want to go to any hospital? What if I don't want copays? Our clients who ask the what-if questions are usually more suitable for a Medigap plan.
That's a great point. I've asked my mom those exact questions, and every year she gives the same answer. That doesn't bother me. Or she texts me, son, I don't care. Just find me the least expensive plan with my doctors.
So, we would like to take a poll and see who wins. Please let us know in the comments below. Who made the better decision and what would you choose?
My mom's Medicare Advantage plan, of course.
Or my mom's Medicare Supplement Medigap plan?
You know who's going to win.
Of course, my mom.
What?
Lastly, we'll leave 2 playlists up here for you. If you are leaning towards a Medicare Medigap Supplement plan, click here.
And if you're leaning towards a Medicare Advantage plan like my mom, then click here. Now remember, help our channel grow by clicking that like button and subscribe. This lets the YouTube robots to know that the video is worth sharing with others. Wait, what do you mean your mom?